FRC 90-90 hip internal rotation, overcoming isometric and manual liftoffs. Hip internal rotation is often neglected, but it's essential to hip strength and hip health. When we are missing hip internal rotation, the quality of our movements, such as squats, deadlifts, middle splits, and pancakes, can be negatively impacted. The FRC 90-90 hip internal rotation manual liftoffs are one of the most effective ways to increase hip internal rotation. However, this is more of an advanced variation, and you need to have a certain level of hip internal rotation before you can perform this exercise. I recommend starting with the basic FRC 90-90 hip internal rotation liftoffs first and increasing your range of motion before you progress to this exercise. Okay, so let's talk about the overcoming isometric and the manual liftoffs. Start by sitting in a 90-90 position on the floor. We will start with the overcoming isometric contractions. In this variation, we will perform the isometric contractions closer to the active end range. In the 90-90 position, internally rotate the hip and lift the rear foot off the floor as high as possible. This is your current active end range. You want to place an elevated surface under the foot so the hip remains at about the same level of internal rotation. To perform the overcoming isometric, place a weight on the rear shin to prevent the foot from lifting off the elevated surface. I like to place the hands flat on the floor, lock the elbows, and set the torso to be as upright as possible. Next, take a nice deep breath into the belly and create tension to limit the movement to the rear hip capsule. From here, push the knee of the rear leg down into the floor before contracting the deep hip internal rotator muscles and trying to lift the foot off the elevated surface. The weight will prevent this from happening, but the intention is to try and lift the foot by using the hip internal rotators. The overcoming isometric contractions can be performed for 1 or more repetitions with a 5 to 30 second hold in each repetition. Next, we'll perform the manual liftoffs. Remove the weight and the elevated surface and return to the 90-90 seated position. From here, push the knee of the rear leg down into the floor before internally rotating the rear hip and grabbing the rear foot with your hand. Use the hand to manually lift the foot and move the hip into the passive end range of motion. This is often a lot higher than the active range. Keep holding onto the foot as you actively contract the deep hip internal rotator muscles. Slowly remove the hand and try to hold the hip in as much internal rotation as you can. You will lose some of the internal rotation and the foot will move back towards the floor, but you should be able to hold the foot higher than your normal active range. Fight to hold the top range for 5 to 10 seconds and then slowly lower the foot to the floor. Perform the specified number of manual liftoff repetitions. Switch and repeat on the opposite side. If you found this video useful, please subscribe to the Sustainable Training YouTube channel, as this encourages me to keep sharing great content.